Welcome to this lecture where we are going to talk about the effects of muscle contraction. Various books have divided this in various ways. I'll try to summarize it in some other way so that we can cover all the aspects of this. There are certain books which say that the effects can be divided into local, then segmental, right, then organic, and then global, right. Now certain books are dividing the effects in this way. There are other certain books which divide the effects on the basis of the nerve, the muscle, the circulatory system, and the chemical effects and the long term effects. Now we are not getting into all these things, and we will work it very simply that when the electrical stimulation is given to a sensory nerve, right, it helps in upgrading the sensation. Normally when we use this is used as a counter irritation or for pain relief. So we will learn in detail about this when we talk about transcutaneous electrical nerve stimulation, right. So we are talking about the stimulation of motor nerve, right. So motor nerve stimulation, it helps in rehabilitation of the muscle, as we have seen in the last lecture. It helps in re-education of the muscle and retraining of the muscle, right. So when you stimulate a muscle with this, it causes a contraction of the muscle, which helps maintain the muscular properties, right. It also helps in reducing the effects of immobilization and inactivity in the muscle. It also keeps the channels intact so that the muscle is ready for contraction, maintaining its properties, the properties of excitability, the properties of contractibility, and the physical structure of the muscle. These are the motor effects of the stimulation on muscle, right. Then there are it causes in improvement of action of the muscle. Depending on the intensity of stimulus you are giving, you can actually initiate or get an response of action in the muscle. Although, as we said previously, that we will be using the intermittent galvanic and then the surge Faradic current in a denervated muscle. So what happens when a muscle is denervated and when a muscle is innervated? If you stimulate a denervated muscle, right? If you stimulate a denervated muscle, if you are stimulating a denervated muscle, the denervated muscle has no nerve supply because of injury to nerve, right. It can be a neuropraxia, that is compression. It can be a neurotemesis, that is complete cut, and it can be a axonotemesis, that is partial. This is complete. Okay. So there are these types of injuries that can happen. There can be a neuropraxic injury, that is compression or temporary compression. There can be an axonotemesis, that is partial cut in the nerve, and there can be a neurotemesis, that is complete cut in the nerve. So whenever there is an injury to the nerve, it denervates the muscle. So So when we are going to stimulate the denervated muscle, we are applying the current directly to muscle. So what type of current we will be using when we said that we are stimulating the muscle? Because it is a large diameter fiber, we will use a long duration current, that is intermittent galvanic. And why we are using intermittent galvanic? Because intermittent current will not allow the muscle to go into accommodation or fatigue, right? That is why we will go for intermittent galvanic. Fine. So whenever the muscle is denervated, there is no nerve supply, so you are using long duration intermittent galvanic current to stimulate that muscle, right? Now if the muscle is partially innervated, right? So if the muscle is partially, means the nerve recovery is taking place, so the muscle is partially innervated. When the muscle is partially innervated, we are going to use the Ig plus SF protocol. That is, we are going to use the surge Faradic also, so that we also stimulate the neuromuscular junction and the innervating nerve, and we also stimulate the muscle, right? So in this case, we are going to use a protocol of here active stimulation or functional electrical stimulation, right? So this you have to understand, that when you are stimulating a denervated muscle, you are going to keep both the electrode on the muscle, and you are going to stimulate the muscle belly itself with the use of galvanic current, right? But when the muscle starts getting innervated, that means the motor neuron starts working in the muscle. When the motor neuron starts working in the muscle, you can use surge Faradic to cause its recovery. I'll also discuss how is the progression of electrical muscle stimulation when you are using it clinically in the later chapters. Now, what else happens when the muscle is stimulated? It causes contraction of muscle, right? So whenever there is a contraction of muscle, it increases the venous return, right? Because it causes squeezing of muscle, right? So it squeezes the muscle. When the muscle gets squeezed, there is an increased venous return. So there is clearance of metabolites from the muscle, and there is fresh blood supply, because when the muscle contracts and it moves out the blood, there is a new blood that is coming inside, which brings nutrients with it, and which brings many other food and nutrition to the muscle, thereby causing an improvement in the muscle's dietary status. So the muscle tends to get better in its function. When a muscle is inactivated or when it is not used, then the muscle tends to go for relaxation, and there is a stasis of fluid in the muscle that again doesn't allow the muscle to work. So as you are stimulating contraction in the muscle, it increases the venous return, it causes a pumping action of the muscle. So with this, the contraction of muscle also causes pumping action, which aids venous and lymphatic return, right? So whenever if there is a stasis of venous or lymph also, for example in cases of lymphedema or in cases where there is venous insufficiency and the venous return is not happening properly, there also we can use this particular stimulation of muscle to aid the drainage of the muscle. So this is again an effect of the muscle on the body. Now it has also been seen that it also helps in improving the muscle's refractory phases. It increases the muscle performance, it increases the muscle performance, and it also helps in reducing fatigability of muscle, or reducing the fatigue of the muscle. These are all the effects of electrical stimulation on a muscle, right? So to summarize of effects of electrical stimulation, on the nerve, it stimulates the sensory nerves, right, thereby initiating the normal cascade. When we talk about the motor nerves, it causes contraction of the muscle if it is denervated, or if it is devoid of nerve supply. When it is partially innervated, we can use the motor units to stimulate the muscle. When the muscle is completely innervated but weak, then also we can use the motor units to strengthen the muscle. It will also help in aiding the venous return, so that it clears the biomedical waste from that particular area, the biochemical waste from the muscle, and it promotes flow of new nutrients and fresh blood into the muscle. It can also help in reducing the stasis of venous and lymphatic supply that are there in case the muscle is not working properly. So these are all the effects of electrical stimulation that we can see when we are talking about a muscle and increase in its property, right? So now next lecture, okay, in this lecture only I will try to accommodate this, that what is the procedure of giving an electrical stimulation, right? Procedure. Now there will be one question that will be in your mind, when to use Faradic and when to use galvanic, and how we decide when we are going to use. So that will be in the next clinical section of this particular clinical application. When I'll just talk about how we are going to assess whether we are going to give Faradic stimulation or whether we are going to give galvanic stimulation. We will talk about it just in a while in the next lecture. But first let us see the procedure. What is the procedure? The first thing is deciding the treatment, right? So you receive the patient, right? Then you review the records, definitely medical records or medical paper or medical investigation, whatever the patient is having, that you have to review to find out whether it is something that is treatable with electrical stimulation or not, whether you can help the patient or not. So you have to know what is exactly that the patient is suffering from, whether he has undergone an injury, whether he has undergone a trauma, whether he has undergone or whether he is suffering from some disease that is causing the weakness. So you have to know the cause of the weakness or the reduced motor performance before we start the treatment. So we are going to go for reviewing record. Then we are going to go for assessment of patient. We are going to check the patient. We are going to check the muscle power. Okay. So there are so many things which you know how to assess the patient, that will be covered in your other subjects. So I am not going to get into detail of that, but you assess the patient of what is the present condition. Then you check the patient for stimulation. So then you explain the process. You explain the procedure to the patient, that how we are going to do this, right? So this is the first cascade that you are going to do. Now what you are going to explain to the patient? So you have to go for number one, patient preparation. So what is patient preparation? The first things first is expose the area to be treated. You are not going to give stimulation to the patient from over the cloth, right? So you have to ask the patient to expose the area by comfortably draping the adjacent area, right? So this is very important that you drape the adjacent area before exposing the patient. So you do not just tell the patient to remove the clothes and lie down, but you have to drape it or cover the areas that are not to be treated, right? So expose the appropriate part where the treatment is to be given. Number 1. Number 2, clean the skin. Preferably, if the patient is a male patient and he has more hairs, you have to tell the patient to clean the hairs because it increases the resistance to the current. So the more the resistance to the current, the more current will be used and it will have a local effect on the skin. So it can give rise to rashes or chemical burns if you use a high intensity current. So you are going to clean the area, and if possible you are going to shave it off, and if not possible, it's okay, we are going to use ample of medium to cover it, right? So you clean the skin, then you go for wetting the skin, then you go for application of electrode. So you are going to place a passive electrode on a nerve trunk that is beyond the part, and you are going to place the active electrode finding the motor point of the muscle, and you are trying to stimulate the muscle with the use of motor point. Why we are using the motor point is because it innervates multiple muscle fibers, so it will give you faster response when compared to otherwise, right? So it can cause a global contraction of muscle rather than a local contraction of muscle. So we are going to go for application of electrode. Again, this will differ on the basis of whether it is completely denervated muscle or whether it is partially innervated muscle or whether it is completely innervated muscle, right? Which also we will learn how we should find out, right? So this is all in the preparation of the patient. Then preparation of equipment, you are turning the equipment and you are placing it in the you are going to go for selection of current with which you are going to treat the patient. So either it is SF or IG. First you are going to secure whether you are going to go for SF or you are going to go for IG. Then you are setting the parameters. Okay, you should be aware that all the leads are well connected and there is no earthing problem or current leakage problem in the electrode or in the patient. Before applying to the patient, you should test the machine on yourself. You will learn how to test the machine in the practical class. You should test the machine. You should see that the leads are intact. You should see that the hydration is intact. So the leads have to be covered effectively with something that can keep them what you can use a wet gauze or you can use a wet cloth or whatever you are using, so that you can keep the plate electrode completely covered as it is not coming in touch with the patient, because if it is touching the patient directly without a medium, it can cause a electrical burn. And we use water to reduce the why we are using water? We are using water to reduce the skin resistance over here, right? So we are using water to reduce the skin resistance, and to avoid concentration of current, you can even cover the pen electrode or the pad electrode with the use of cotton or a gauze piece or anything that can be wet, and it can be used as a interface between the electrode and the patient's skin. Okay, so this is and you have to make sure that the intensity is zero each time you are touching the electrode to the patient. This is very important. So first you demonstrate the current to the patient and you have to make it sure that always when you are moving the electrode of the patient, the intensity has to get 0, because if with the on intensity you touch it to the patient might get a jerk or he might get a shock, which can fear the patient or make him fearful. So be sensitive when you are applying electrical current, right? So with this I end this lecture, and in the next lecture we are just going to go into the selection of current and the progression of treatment, how we are going to do it. That we'll see in the next lecture. Till then, take care. Bye-bye. Finish these lectures and do go for studying with the lecture. As I complete the lecture, open your book or keep your book together or keep your notes together. Make notes of these things and try to match them and read them so that you can write. After each of these lectures, I will be providing you with a sheet that you have to solve, right, for checking your knowledge after the lecture. So be happy, start learning, keep learning, and stay safe when you are in home right now. Use this time in maximizing your leverage towards studying by yourself. Okay, so and if you have any questions, you can directly message me or you can mail me at Ashish Nagar ashish.physio@gmail.com. It is given in the description box below. For any questions, you can leave them on my email ID and I'll try to explain the concept again to you in detail, right? So till then, take care. Bye bye.